Hey, everybody at the Young, Bold, and Regal audience and abroad worldwide. Evan Jackson here, CEO of Young, Bold, and Regal. We're here incredible today, an incredible Monday, having Dr. Swiner and Anna Palomino talking about Black girl vitamins and their support of Black women's health. What I loved about this product is that it's not only a product, it's not a brand, it's a message to Black women to ensure that their lives are extended and are longer and healthier, and so is the other women around them. Speak more about the importance of Black women's health, but also the importance of how Black Girl Vitamins plays a role in that.
Yeah, yeah. Thanks for having us. I have truly enjoyed being a part of the community of Black Girl Vitamins, both as a medical advisor for the past year and a consumer. I'm a customer too, so I take my regimen religiously of a variety of the different vitamins, and it definitely makes me feel great to be a part of this community of particularly young women. I'm definitely of a different age and phase of life. But I love seeing the young ladies, the 18 to 25-year-olds, really take control of their health and wellness. So I've enjoyed being a part of the movement.
And for me, for one, I mean, this company, this mission has just always been very close to me. I'm very passionate about it, especially when, I show up on a daily basis. I see our team members. We're all just grinding in the same direction of the mission and we're seeing the output. We're going out in the streets and we're seeing a difference. We're seeing a difference in our community. So that really encourages us all, including me, to keep pushing. I'm sure Dr. Swiner could say the same thing. I see her out at our events and she's so passionate about it, much like all of us here.
And then, Dr. Swiner, talk about some of the statistics that some Black women should know about Black women's health overall, and then where that's trending, and also Black Girl Vitamins' role when it comes to assisting with that, making Black women continue to be healthy, especially when it comes to their bodies.
Yeah. Well, I think, fortunately, we're becoming more aware of the not so good stats that we lead. We lead the pack in a lot of different ways. And unfortunately, when it comes to our health and wellness as a population, unfortunately, we are dealing with things like heart disease, hypertension, breast and lung cancers, HIV. Almost any of those major chronic illnesses that have unfortunate outcomes, unfortunately, we are on the top of the list. And that's not a good list to be on the top of. So this mission, as Anna mentioned, this movement has definitely brought a lot of those things to light, stuff that we probably already know. And have been hearing a lot about in the media. If you add in maternal morbidity and mortality with birth, issues and complications, we hear about those horrible stories, but then what are we going to do about it? And I think with Black Girl Vitamins, not only is it giving you a tool to use or multiple tools to use, but it's giving you the resources to kind of learn and be educated, to advocate for yourself, to advocate for us, and to take those things back to your healthcare provider so that you can make those necessary changes and then ask for the things that you need so that hopefully the incidences and the rates of these horrible outcomes will be decreased.
Yeah, and then Anna Palomino, I wanted to ask you, talk about the atmosphere that Black Girl Vitamins presents when it comes to presenting Black Girl Vitamins to Black women at large. What I love about it is that you guys take care, you guys take time, you bring in great experts like Dr. Swiner, and you make it not only about Black women, but this is, the world's issue to also handle as well. We Black women need the world as Black women as much as the world needs Black women. So I like that atmosphere, but speak about it more specifically. Thank you.
I think what a lot of people don't understand, only because, we don't really show it as much, is from inception and from, just a very internal basis, we take this environment and atmosphere very seriously. We show up as team members and we take it very seriously. I believe that because we take it so seriously, it's very easy for, it to come through on our socials, in our events, in our products, in our newsletters. What is important to us on top of all of this is we want Black women to feel represented and taken care of and seen and heard and prioritize. That is something that is very big for us. So if you speak about the atmosphere or environment, it is Black women are our priority. And that's what we're looking at. We're looking at creating solutions for Black women, whether in the form of products or education, or just ensuring that, we have experts like Dr. Swiner just available on our webinars to ask to answer questions by our community. We're trying to create a movement here, Evan. It is more than simply just putting out products. It is, as you said, it starts as the atmosphere, it starts as the environment, and then it becomes a movement. That is what we're looking at.
Yes, and then I like how Dr. Swiner talked about there's been more conversations not only in the world but in mainstream about keeping Black women healthy and also just products necessary for them and specific products. I wanted to ask you, what's your introduction to Black Girl Vitamins? What made you say, "Hey, I want to speak at these events. I want to be a part of these panels. I want to be part of these conversations"?
Yes. So I fell in love with Black Girl Vitamins first on social media. I saw my friends, my colleagues, my, folks that I follow and vice versa, sharing their excitement about this new brand, this thing that was just for us in the health and wellness world. And I actually had a friend of mine post a story on her Instagram about them looking for brand ambassadors and folks to help out, to collab with the brand and partner with the brand in different ways. And because they were aligned with my mission, which is, to be well and not be a superwoman and take better care of yourself, I said, I'm going to reach out. And so I reached out. I can't remember who it was that I corresponded. It might have been Anna at the time, but I corresponded with them via email. I was like, look, we are in the same vein. We have the same mission, the same passion. Put me in, coach, right? Like, where do y'all need me? I'm ready. And at the time, I think they were like, well, we're kind of booked with ambassadors at this point, but here's some samples to try. We would really love to see how you love them because they knew about my medical background. And so when I tried I think it was either the once a day or the vitamin D3, fell in love with it. It was yummy. It was a gummy. It's easy to take. I felt, better. I felt like I had better energy. I glowed different, all that good stuff. And I was like, oh yeah, I'm definitely a fan. So when I reached back out to them later on, I was like, are you sure? You're ready? I'm ready to help. I'm going to post about it. They said, let's do it. We're looking for medical advisors and we would love to have you on the team. So that's really how I was drawn in. Initially, it was on social media and just watching how engaged their fans were and how wonderful they how I don't know how great they felt. They were having fun, but they were presenting health and
Yes.
wellness in a way that was really engaging to young Black women.
Yeah, and how I got introduced to it through my friend Sophia, and I have a lot of important Black women in my life. My mom, my sisters. So whenever there's a chance for me to step up and advocate or amplify or go to the mountaintop and speak more about Black women and Black women's health, I'm one of the first people to do it. Getting back to Anna, talk about the one of your latest Vitamin Girls products, Her Balance, correct?
Mhm. That's correct. I
Yes.
would love to talk about that product. That is something that we've worked on for so long, and something that I'm gonna always say we're passionate about every product, but we're equally, probably just a little more passionate about this last product that we've released. And it's because when I tell you we started from scratch, we took all the clinicals, we looked at all the data to say where are Black women right now in the vaginal space. And I don't know if this is going to be shocking to you, but the summary of that was nowhere. We couldn't
Mm,
find data catering to Black women, especially Black women's vaginas, as we would find, of other groups of women. So naturally, Black Girl Vitamins, we heard you've been, well, put me in, coach. You've been someone trying to develop something for Black women and something that actually works, something that caters to some sort of way in which we're different vaginally. So if you were to look at our formula, for example, our formula speaks heavily to this. Our formula has 10 billion CFUs, which if you want to compare it, you'll see this is such a great product. And it's because we're starting from where Black women are. We're unique, we're special in every way of the word. We're unique and special. And so this product speaks to that heavily. I want to just add one more thing, if I
yeah.
may. Uh, or doctors and or chemists. It was a very back and forth process with this formula. And it's because, again, something that means a lot to us and means so much to us is, are we solving a problem here or are we just putting out a product?
Hmm.
If we cannot answer a question, that is almost an immediate roadblock for us. And so when I tell you it was so much back and forth trying to figure this out, I want Black women to feel proud of this product in their hand because believe me when I tell you, it was formulated for you. It was formulated for us. And just to make our lives easier. I mean, I can share my experience as a woman and just based on the data that I saw when, we're trying to do the market studies for this product, it's that it's not, just waking up every day and just, oh, you have great vaginal pH and great vaginal balance. Your vagina is great. It's not that. It's a case of all these layers and steps. And as Black women, I don't know if you know, but we typically have less of that good bacteria that, other groups typically have. So not only are we dealing with normal women vaginal problems, but we add on top of it, oh, we have fewer of the good bacteria.
Mhm.
So this product here that we developed, it's supposed to help make Black women's lives easier. That is the goal of it.
And I like how you said that last point because that you made it very inviting for people to know a lot of these complicated medical terms, these complicated medical ongoings when it comes to women, when it comes to Black women. And I wanted to ask Dr. Swiner, talk more about that, how not only Black girl vitamins, but at large, the medical community is realizing, wait, Black women are different and we need to have their health concerns to be addressed properly for them, not based off of anyone else.
Yeah, it's vitally important, particularly when it comes to, I talk to women every day about the difficulty in finding the right type of provider or the right kind of doctor that will listen or that knows a lot of these things or that's open and willing to learn about some of this stuff if they weren't trained on it, right? To listen to women when they come in and say, hey, you may not know, but hey, I read this study. Here's this research link that I pulled up. Let's discuss it. I think as a medical community, we're getting a little bit better with being more open and accepting to, things that may not be traditional Western medicine. It may be things that our grandmothers, aunties, moms taught us from way back when that actually work. And so I'm proud that this brand in particular takes a lot of that also into consideration when introducing a new product or when creating new products is not only are they focusing on very new, up and coming research data, but we're listening to what our ancestors were doing centuries ago that worked, that kept them healthy,
Yes.
right? And so I love the combination of the two. I love that we can have these open conversations. I love the webinars because that's really where the discussions get started and the people ask those quote stupid questions. There are no stupid questions, but those dumb questions that they may be afraid to ask their doctor or may not have enough time to ask their doctor during their appointments. They come, we have those conversations, and then they can take important information back. So I love the balance.
Yes. And the last question for both of you, what do Black men need to know more about Black girl vitamins and Black women's health so that we're just more informed? And the reason why I'm asking this is because we don't live in a vacuum, right? We don't live in a silo.
Mhm.
So I want Black men to also be involved in the interest and the information as well.
I love
I
it.
think the step one for Black men is to understand that Black men don't know everything about Black women. And so we need to start and continue to listen to our women. If we experience something and we want to communicate that we're experiencing this, just listen and try to understand. When I tell you, again, this is a benefit of, working in this space and talking to people outside of the space is you understand clearly a woman's perspective and a man's perspective. When we share the things we go through from a medical perspective and, from a supplement basis, men are like, whoa, women do what? Women feel what? And we're like, yeah, that's the thing. But just listen and try to understand. just provide support. Support comes through the form of listening, comes from the point of asking, what can I do? What can I read? Dr. Swiner spoke to up and coming research data. That is something that, I'm not sending men to go read clinicals now, but did Black Girl Vitamins put out a social media post about a particular condition? Maybe take the time to swipe and read, share it with your friends, share it with your other male friends, because we need to normalize talking about women's health, Black women's health in our community overall. That is what I would say.
I love that. I love that. And Evan, I'll add, so I love that question, number one. I don't think I've ever gotten that question, particularly from a Black man. I love that. So shout out to those men who are already allies and advocates for us in the health and wellness realm. I certainly have one in my household. My husband lives with three women, so me and my two daughters who are big fans of Black Girl Vitamins. So he proudly rocks the merch and has a tote bag, and like he's a proud defender of Black Girl Vitamins as well. And I get Anna, we talk, many men are asking, well, where's the Black men vitamins? Like, we're ready too. But continue to encourage, celebrate, support your Black women in their health and wellness journey. Celebrate that they are drinking more water and going to the doctor for the physicals and getting their screenings done and taking their vitamins. Celebrate that. And then be an advocate for them. If you need, go with your most favorite Black woman to her doctor's visit if she'll allow you, so that you can be there as an ally, an extra ear, and just encourage them. And the last thing I would say, particularly about the Her Balance probiotic, when it comes to being healthy in that area, it takes our partners also being healthy. So if your partner happens to be a male or a Black male, then needs to make sure that his body is healthy so that your body can be healthy. So you all need to like talk to each other if
Yes.
things are off balance, right? And if there are
Hmm.
chronic things that happen recurrently, we need to make sure that he's healthy. So having that open and honest conversation and relationship is important.
Yeah, so thank you, Dr. Swiner. Thank you, Anna Palomino. Thank you, Black Girl Vitamins, for providing such a stage for me to speak to you ladies, but also speak about such an important topic about Black women's health. And, 13 years of creating Young, Bold, and Regal, we always say Black women are the centerpiece, not the only piece. So when it comes to health, medical reasons, entertainment, entrepreneurship, Young, Bold, and Regal will always cover it and welcome a platform. So thank you, ladies.
Thank you.
Thank you so much for having us. Much
All right.
appreciated.